Welcome. Good morning. Afternoon. Welcome to the regular meeting of the Public Health and Safety Committee for March 5th, 2025. I am Jason Chavez, and I am the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison.
Here.
Palmisano. Present. Vice Chair Wansley is absent. Chair Chavez.
Present.
There are 5 members present.
Let the record reflect that we have a quorum, and thank you all for bracing this horrible weather conditions. With that, the agenda for today's meeting is before us. There are 3 items on today's consent agenda. Item number 1 is authorizing acceptance of additional funds from the Minnesota Department of Health for a grant supporting commercial tobacco prevention efforts. Item number 2 is authorizing a revenue contract with the University of Minnesota for bomb detection at Huntington Bank Stadium. And item number 3 is setting a public hearing for March 19th to consider an ordinance relating to Community Commission on Police Oversight Review Panel temporary assignments. And colleagues, I gotta open up the queue. Is anybody on queue? Council President Payne.
Thank you, Chair Chavez. Yeah, I'll just give a little context on the CCPO ordinance. We are working through our backlog of review panels, and we're also in our open appointment process for all of our boards and commissions right now for the spring session, and we've got a few openings on CCPO. Those openings are really critical for us being able to work through the review panel, and so this ordinance is giving us the temporary ability to tap into our existing Civil Rights Commission for members who do have the appropriate training to be able to sit on those review panels and work through that backlog. So I just wanted to give that context. If I get anything wrong, Director Phillips can correct me. I got it all right.
Great, thank you. I also acknowledge that Vice Chair Wansley is with us here today. So I'll move approval of items 1 through 3. And seeing no further discussion, all those in favor say aye. Aye. Those opposed say nay. Any abstentions? That carries, and the consent agenda is approved. Our last and final item is receiving and filing a report relating to progress on the community safety ecosystem, including progress on the Safe and Thriving Communities Report, pilot programs, and community safety centers. Here to present on this item is our staff. We'll begin with Director Amanda Harrington, who I believe will kick us off.
Thank you and good afternoon. My name is Amanda Harrington. I'm the Director of Community Safety Design and Implementation with the Office of Community Safety. As you noted, Chair Chavez, this is my quarterly update about the work of the community safety ecosystem. Just to ground us in the mission of this work, we are working to develop, support, and sustain an innovative, collaborative, and evolving safety ecosystem that ensures equitable outcomes for all Minneapolis communities. This acknowledges that there is already an ecosystem that exists. We're just trying to make it better. One of the most significant pieces of work that has been done in the last quarter is releasing the asset and gaps analysis that was completed by NYU. They had done a presentation to PHS in November, and we publicly released the full report in January. We recently added an interactive dashboard, just like we did for the Safe and Thriving Communities report, to our webpage. This is also publicly available and can be found at minneapolismn.gov/community-safety-ecosystem. I did want to share a little bit about the work that we've been doing implementing some of the actions in the Safe and Thriving Communities report and the NYU Asset and Gaps analysis. The chart that you see on the screen actually shows actions or recommendations with deadlines in 2024 or 2025. The screenshot is as of February 28th, which was the date that I submitted this presentation to council, so obviously the numbers might be slightly off from today. Today there are actually 43 tasks completed between both of those reports. And 12 recommendations have been completed since our last quarterly update in November. I'm not going to go through all 12 of them, but wanted to provide a few examples. We formed committees that match the recommendations from the Safe and Thriving Communities report to be focused on prevention, response, and restoration. Those committees increase accountability and also are based on written norms and procedures. We also have the government asset and gaps analysis. As I noted, that was done through NYU. And we have approval of an IT modernization plan, which was approved by the Minnesota Department of Human Rights and ALIFA, which is a really great example of the work because it overlaps between police reform and this community safety ecosystem work. It's really all one thing. I do think it's important to reiterate that work had already begun when I joined the city. So 4 tasks were completed before I even joined the city in December 2023, and another 6 were completed in my first 4 months of work. And while I would like to take credit for those, I am not that effective. So there has been work that's ongoing, and the rate of accomplishment has increased since I started. I previously talked to you about the new committees, Prevention, Response, and Restoration, but I wanted to circle back to the steering committee. This is something that I had shared in previous reports to this body. We are entering a new phase of this work where we're not just laying the groundwork for the community safety ecosystem work, but we're really plowing ahead with implementation. This committee is formed now to steer that implementation. The reporting structure is the same in that they are available to consult with my team, and we report up to the commissioner. But the membership of the steering committee has changed. You can see the members on the screen. And the goals of this group are to act as champions of the community safety ecosystem development, ensure collaboration between the offices of community safety, public service, and the city attorney, provide consultation and support for the design and implementation team, oversee implementation of the launch list and governance management and accountability sections of both reports, and ensure accountability for all city staff in making progress on this body of work. I also wanted to provide brief updates on the community safety centers. The Lake Street Safety Center has had one service added, which is the Be at School program. That MOU was approved by City Council, and staff from the Be at School program have been going regularly to the Lake Street Safety Center. I had noted before that we had offered to partner with Metro Transit. That is still in progress. They have legal counsel reviewing the MOU that we've shared with them. LEAD does continue to come to the Lake Street Safety Center regularly, although I would note that they don't currently have case managers to accept new clients, but they continue to be a really strong partner. And we have worked with the 311 staff to figure out how to take police reports, non-emergency police reports, out of the center. IT offered us a solution, and we're in the process of implementing that solution. We hope it'll be a month or so, and we will definitely let the public and this body know when we're able to take non-emergency police reports out of that location. I do want to note that we continue to communicate about this center. We know it's new. I've said from the beginning it's going to take time and word of mouth for people to understand what's in this center and for them to utilize it. But we regularly put out communications in dispatch, the OCS dispatch, news bites. We promote this at community meetings. We continue to talk to the news media about this, including an interview and tour that I did recently. Talk about it with Metro Transit, at the Lake and Hiawatha LRT and Bus Stop Livability Coalition, at MUD meetings, pass out informational flyers everywhere I go, and we're creating new flyers that we can hand out to end users, so not just information about the project itself, but to help people understand what are the services they can actually get at the center. We plan to have that translated and handed out as soon as we have the capability to take those non-emergency police reports. In general, utilization of the center has gone up since it started. In November, we had 22 individuals go into the center. In December, that went up to 32. January was 46. And we saw a drop in February down to 29, but we also had that unusual stretch of sub-zero days, which I'm assuming impacted people kind of walking around our city in general. Previously, when I've been in front of you, I talked about some of the success measures that we wanted to use with the Lake Street Safety Center. Utilization is obviously one of those, but we also wanted to figure out what people were going to the center for. You can see some of the reasons on your screen, and the biggest one is other outside services. That tends to be individuals asking for the bathroom or to use the phone. They are also looking for the dentist office that used to be in that location, but they're looking for apartments. And there's a lot of general curiosity just asking what the center does, which is a good thing. There's also requests for other city services that again might be how they're categorizing requests to know what the center does, but also looking for city job applications or to meet with Office of Community Safety staff, because we try to have that space activated as much as possible with our own meetings. We've also been tracking the utilization of the conference room, and we've had a number of meetings in that space, meet and greets with the city staff and partners in that space. We've met with Hennepin County. Crime prevention specialists have met with business owners. We held informational meetings for the potential safety ambassador vendors during that RFP process. And we also had a visit from the DFL members of the House Transportation Committee. We do plan to measure customer satisfaction. We have an optional survey that has been up and available. Because it is optional, we have not had any takers on completing that survey yet, but we do continue to offer that to individuals going into the center. And we plan on gathering information about city staff and provider satisfaction and collaboration in the coming months. This summer, we also hope to host events that will increase awareness and utilization of the site. I have less to update you on about the South Minneapolis Community Safety Center. We are on track. We continue to have meetings with the design and architecture firm. Those meetings happen weekly with various stakeholders, including Office of Community Safety, 311, Minneapolis Police, and the Sustainability and Energy Management folks. We are moving from understanding space programming and preliminary room blocking to a more detailed schematic design process, where they start talking about thickness of walls and doors and get very detailed in the design of the space. The last section of this presentation I will hand over to Bethlehem Uhalawork, who will be providing updates from performance management and innovation about safety pilots we've been collaborating on.
Thank you, and welcome.
Thank you. Good afternoon, Chair Chavez and council members. I'm Bethlehem Uhalawork, and I'm a program manager with Performance Management and Innovation. So an update on the Community Safety Ambassador Pilot. This pilot aims to provide tailored, community-driven solutions to enhance the safety and well-being of residents, businesses, and visitors. These ambassadors play a crucial role in fostering trust between residents and local authorities, addressing common livability issues, and enhancing the overall sense of safety. 2 teams of ambassadors will patrol the East Lake Street and Franklin Avenue cultural districts and conduct street-level outreach, such as providing safety escort services within district boundaries, sharing referrals to social services, and conducting public relations checks with businesses in the area. We met with community-serving organizations, local business associations, the Minneapolis Public Schools, and Minneapolis Park Board to help shape the ambassador's process and protocols, including hours of operation and key activities. One reoccurring theme that we heard was the need to support youth commuting to and from school, and in response, we prioritized daytime hours for ambassador patrols to meet this community need. We've also contacted and connected with the Downtown Improvement District to better understand their business process and operations, as well as data collection methods. Additionally, we engaged in an RFP process to contract with a local organization to provide the ambassador services. The contract was approved at the February 27th City Council meeting, and we are now in contract negotiations with the vendor. To ensure that data collection and transparency, we will include performance metrics in the contract and are working collaboratively with the vendor to refine the performance measures. These measures will focus on ambassador activities and assess the program's impact in enhancing safety visibility and resources in the area, like number of referrals made by ambassadors, number of interactions with community by type, and % of identified livability issues resolved within a specified time frame. Data will be collected and reviewed throughout the pilot period, supporting continuous improvement efforts. A public-facing dashboard will also be developed, providing data on the ambassador's incident responses. We're also in the process of hiring a public health specialist who will serve as the contract manager, as well as 2 dispatch staff who will be stationed in the Lake Street Community Safety Center, monitoring cameras and having direct communication with ambassadors, as well as internal city stakeholders to ensure that effective communication and information is shared with the appropriate parties. And our goal is to have safety ambassadors in the community by spring of this year. The Embedded Social Worker pilot is another program that we are working through, and the goal of this pilot is to enhance emergency response and provide timely assistance and effective support to community members who are experiencing mental health, substance abuse, or social service-related issues who contact 911. A person in crisis will be triaged and transferred by 911 call takers to the embedded social worker, who will provide real-time support, consultation, and referrals for resources or social service assistance. This pilot has been a collaboration of MECC, the Office of Community Safety, and Hennepin County Behavioral Health to gather information by researching best practices and approaches, including shadowing the Ramsey County Embedded Social Worker Program. 911 data also indicates that the majority of calls, including crisis-related incidents that the embedded social worker could help support, occur between 4 p.m. and 6 p.m. And to support this peak period, we plan to integrate 1 social worker into MECC 5 days a week from 12 p.m. to 8:30 p.m. This will ensure coverage during peak hours while also allowing for crossover with management for regular check-ins and coordination. As we continue to work into the implementation phase, a joint powers agreement between Hennepin County and the City of Minneapolis has been drafted and approved by the City Council at the February 13th meeting and will come before the County Board on March 11th. A few key milestones and next steps on the timeline include hiring and training the social worker, as well as developing a data collection system compliant with HIPAA privacy laws. We will rely on the data collected throughout the pilot period to support continuous improvement and help us better understand capacity needs. We anticipate that the social worker will begin responding to calls in August of 2025. The traffic control response pilot would shift non-injury collision response from the Minneapolis Police Department to traffic control. Dispatching a traffic control agent to the scene of a non-injury collision would provide community members with a customer-focused direct response to help file a report and clear traffic. This pilot aligns with the responsive strategy outlined in the Safe and Thriving Communities report and the assets and gaps analysis by addressing non-emergency incidents in real time through civilian response. At the last AEO committee meeting, PMI provided an overview of the data analysis conducted to better understand the frequency of these collisions and their response times across the city. Based on our data analysis and project team discussions, dispatching 4 to 6 traffic control agents in precincts 3 and 4 from 11:30 to 8 p.m. will support nearly 65% case response rate within the precincts. We are working to refine the design of the traffic control response pilot to account for the capacity needs of our stakeholders, such as expanding support for MECC with 911 call takers and 911 dispatchers. We also plan to leverage our Department of Justice funding for this pilot. And lastly, the juvenile deflection pilot. This pilot aims to transform juvenile deflection by connecting at-risk youth to upstream services like restorative circles, mentorship, and mental health support. This approach could help prevent deeper involvement in the justice system by addressing the root causes of youth crime. The Minneapolis Police Department has a youth diversion program in partnership with Restorative Justice Community Action that's overseen by the City Attorney's Office. This program diverts youth who qualify based on their offenses, enabling them to engage in restorative justice practices. However, a critical gap persists. There is currently no mechanism to offer services to youth who come into contact with law enforcement but don't have a chargeable offense, known as deflection. This gap leaves at-risk youth without access to needed support and resources. So by reframing our response to youth in crisis, we can help break the cycle and build brighter, safer futures for our youth. Preliminary research and information gathering is underway for this pilot, and further pilot design has paused as we're working on securing a funding source for the work.
I want to say thank you to this body for your openness to allowing PMI and OCS to present together. I think it's important that these pilots be seen in the context of the larger body of work, which is creating this holistic community safety ecosystem. That does conclude our presentation, and we are available for any questions.
Thank you so much for the presentation. I'll first pass it on to President Payne.
Thank you, Chair Chavez, and thank you for uplifting that kind of cross-departmental collaboration. And in the spirit of that, my question is around, I know that in our budget process this year, we made a budget amendment so that we could have a deputy director in OCS, and my understanding was that this role was to try to help bridge some of these cross-departmental collaborations that are necessary, particularly as it relates to connecting the body of work of safe and thriving communities with the implementation of the consent decrees. I'm curious if there's any updates on that, and even if there's not like a HR level update on that, if you have any kind of insights of how you would see someone in that role helping connect some of these disparate dots.
Chair Chavez, Council President Payne, thank you for the question. The deputy director position in the Office of Community Safety has been posted. And I am not involved in the HR aspect, so I can't provide an update on that. But I have definitely talked with other leader members in the Office of Community Safety about how that role absolutely would provide kind of that crossover between the police reform and the community safety ecosystem work. I've been invited to quite a few of the meetings with the police and the commissioner about settlement agreement work, and it's hard for me to be in multiple places at once. And so we understand that that position is very critical. It's also one of the recommendations in the Safe and Thriving Communities report to ensure that we have planned crossover between the two. So I'm very much looking forward to that person being hired, and I'm sure that we can get a further progress update from others in OCS.
Awesome. And then my other question, it was really, first statement, really exciting to see the deflection work getting presented in this context. The last note we left on was sourcing funding, and I was just curious, are we at a stage where we have a sense of the scope of what that's going to look like from being able to estimate funding, or are we still kind of in the very early stages of sourcing funding, even just from piloting and prototyping perspective? Do you know what I'm asking?
Yep.
Yeah.
Chair Chavez, Council President Payne, thank you. We are actually in the very early stages of scoping out that project, which means we don't necessarily have an idea of even cost or how many personnel would be involved in that. One of the things that we're talking about with securing funding is obviously startup funding for pilots, ongoing funding, but we had also considered some outside resources for funding. What was the Bloomberg Years Challenge? We did apply for one opportunity.
Yes, so Chair Chavez, Council President Payne, we did apply for funding through the 2025 Mayor's Challenge through Bloomberg, and so are waiting to hear back from them on the application.
I'm sure there's more I could say, but thank you so much for this presentation.
Councilmember Palmisano.
Thank you, Director Harrington. Thank you, Ms. Uhalawark, for all of the information you provided. I think my questions are really about like the connectivity, the connective tissue between all of these things, and maybe I could just ask you a few. I've stated this concern before. How do you see the Community Safety Ecosystem Steering Committee interacting with the Safe and Thriving Communities Work Group? The one I've learned is a very, and you had it up on the screen there, I think it was slide 6, was a very internal working group. This other one is really more about sharing with community in a consistent way. Will those two things come together? The one that is in existence is a pretty large work group as it is.
Chair Chavez, Councilmember Palmisano, there's some work to be done yet because that Safe and Thriving Communities Work Group was just recently approved by this body. And so I need to have some meetings with the clerk's office to figure out next steps on how to integrate our work into that. From what I've seen, there will obviously be some overlap in that they're both advising my team and OCS at large about this work. The steering committee's role is very internally focused, including ensuring that we are moving forward and meeting our deadlines on specifically the governance and accountability recommendations in the reports. That's not something that we would be asking the work group to be doing, although we may be asking for their advice on how to connect with the community, get feedback from the community. If we have ideas for pilots that come out of things, asking the community work group for advice and input on those things. So again, there's some overlap that we're going to have to figure out, but I do see them as distinctly separate groups.
Yeah, thank you. I do see how they could both be valued parts of a larger thing. I just not sure if they would issue progress reports back and forth to one another or how something like that could all come together, but that's yours to do. A couple questions on the Lake Street Safety Center. Thank you for everything you shared about it. There was a news report, I think within the last couple weeks, that showed there to be sort of a slow start, and you've explained it. I also get that it may take a while to gain the community's trust. Do you have any historical sense from other projects as to how long that might take? And if not, I mean, that's a difficult thing to gauge.
Chair Chavez, Councilmember Palmisano, I haven't asked any internal folks about how long it took for utilization of prior safety centers, for example.
Yeah.
That's an interesting opportunity, as we do have staff that were involved in those prior safety centers, and so I could ask them. What I did ask about before the Lake Street Center opened was our neighbor just across Lake Street, Hennepin County, what their experience was like opening their service center in that location. Mm-hmm. And they told me it was very slow, and that it took a long time, and that it took word of mouth for them to get people to come inside and utilize that, because people just weren't used to having that space accessible to them.
Yeah, and at first I felt it was disheartening to see that, over half the visits to the center were like for a bathroom or something similar, but at the same time, even those simple visits really help raise the trust and the knowledge about what's in there and the visibility of that center. I'm glad to see other city services and permits were not an insignificant number of visits, though. Do you see normalizing those services as being a part of that trust building? Like, do you want that to continue to be the case?
Chair Chavez, Councilmember Palmisano, we certainly want to normalize that people can seek services within their community. And I've said from the beginning that this, for me, is really a pilot so that we can figure out how this could work when we have a more robust, fully operational 311 service center available at the South Minneapolis Community Safety Center. So the idea of people going, even for some tasks at the Lake Street Center, and knowing that they could access even more of those later when the permanent location is open, is very positive. Part of what we need to figure out is what is it that people actually need in that area so that we can better promote it. And because they don't offer all of the services that a fully functional 311 service center does, we need to narrow down what is the capability.
Yeah. I hope we can transition all that trust and community knowledge over to the new South Minneapolis Safety Center. I get that even the setup of it with a frontal parking lot is just different. You'll get different types of traffic in there. A question on the juvenile deflection pilot. Something that I've learned from Lieutenant O'Rourke with MPD is that they run a juvenile diversion center on the city side. This is different than the county programs. So how will this pilot project differ from that, and how will it coordinate with Lieutenant O'Rourke's program? It's not really his, but will it coordinate with our city programs or the county programs, or is it meant to be both?
Chair Chavez, Councilmember Palmisano, thank you for the question. I'm actually uniquely qualified to answer that because I previously worked in juvenile prosecution at the county attorney's office. I've been working really closely with Lieutenant O'Rourke and staff in his office on the existing MPD juvenile diversion program. We've been increasing clarity on their eligibility criteria as well as data tracking systems. That's part of how we figured out, in addition to Council President Payne pointing this out, that there's a gap. Lieutenant O'Rourke has often pointed out there are youth who his team comes into contact with who don't have a chargeable offense, therefore are not eligible for diversion. But they still need services. People clearly have concerns, whether it's the police who encounter them, friends, neighbors, parents, guardians, and that's where we have been having problems, and he has a great desire to be able to refer those youth someplace. He doesn't have the staff capacity to currently do that, and we don't know where exactly to refer them to. I will say we have identified some existing resources that could be considered deflection. He and his team have already been referring youth to the auto theft intervention pilot at Hennepin County. That is a deflection program. We also have eligibility for YGVI. You don't have to have a chargeable offense to be referred to YGVI, and he has been making referrals to that program. That's a very narrow subset of youth that MPD encounters. So if we have any youth who have at-risk behaviors and they're not involved in auto theft and they're not group or gang involved, we don't currently have anywhere for them to go. And so those are the pieces that this pilot sets out to strengthen.
Thank you. That's helpful. I think that generally speaking, people whose focus is public safety don't even know that there's a city program and a county program, and that these two things have similar offerings. Basically, it's different doors to the same type of program in my little bit of understanding in it. But thank you. This is helpful, and this helps show all of that connective tissue that is about building this out as an ecosystem. Thanks for your work.
Vice Chair Wansley.
Thank you, Chair Chavez. Thank you, Director Harrington, also for this presentation along with PMI. Was super excited to receive this one. Just starting off with slide 12 regarding the Community Safety Ambassadors pilots. So I know, was it the 2023 or for the 2024 budget cycle? 2023, Council appropriated about $3 million for these specific pilots. You mentioned we approved several contracts specifically for Metro Youth Diversion last cycle, which total around $500,000. So just trying to get a sense of, are we anticipating additional pilots to be developed? Because I know this one focused along a specific cultural corridor. So yeah, just wanted to get a sense of where the rest of those dollars will go and if we should be seeing that correlated with additional pilots targeting other cultural corridors.
Chair Chavez, Councilmember Wansley, because we are piloting the program, we didn't feel that having more than 2 sites would work for us to truly pilot it well, to design it, to take the data, to measure it. It's why we chose 2 sites, although I think there were 11 possibilities that came along with the original earmark. Our hope is that it will be successful, and if we have data after 6 months to show that success, then we can start expanding. We're already working with data analysts to figure out what the next 2 corridors would be that we would expand to. We're a little nervous about saying 6 months of data would be sufficient. It's not ideal to have that limited data set when we're making decisions about expansion, but we do again, hope that this works, and that's why we didn't utilize the rest of that money, because we would need that to expand to the rest of the cultural districts and other special service areas.
Okay, thanks for that clarification. And then going to slide 13 for the embedded social worker program. Just wanted to get a sense too if these social workers would do any type of coordinated engagement with the social workers that's also embedded within the Minneapolis Police Department. I know 911, they're taking in calls, but what we've also heard anecdotally from MPD is sometimes they're responding to similar like 911 dispatch calls. Social workers are also being used to support calls or maybe repeat calls. So just trying to get a sense of how those two also might be relating to each other or 2 programs.
Okay. Councilmember Chavez, or Chair Chavez, Councilmember Wansley, I'm going to take a crack at this, and then Bethlehem's available to support. Our idea is that the embedded social worker will take calls, but also during that part of their shift, our hope is that they can do follow-up care. And if they don't have capacity to do follow-up care because they are just one person, that they would utilize their peers that are embedded in the precincts to do that follow-up care as well.
And that, okay.
I got it.
Pretty good. Okay. Great. And then going to slide 15, just building upon some of the questions that Council President raised. Starting off with funding source also. So I know Council, we also appropriated about $500,000 towards Safe and Thriving community pilots. So you mentioned a funding source has been kind of question mark for this, and just want to get a sense of why not use that as a source, because this seems to be in alignment with what that was brought forward to do.
Chair Chavez, Councilmember Wansley, we learned about the external funding opportunity, I think, while the budget process was taking place. And so it seemed smart to apply for it while it was available. In addition, it seems, you know this better than I do, it seems that we're in a really tight budget situation in the city. And so we'd like to utilize any available funding possible. If the external funding is not available to us, then we have a backup plan of the earmark that was set aside for pilots.
Okay, so is this kind of the preferred approach then in terms of like using appropriated dollars just as like last resort and using that in combination with some external funding sources too? For pilots specifically.
Chair Chavez, Councilmember Wansley, I wouldn't say that that is a broad way that we're looking at pilots. It's just how we're looking at this particular pilot.
Okay. And then have you gotten to a place where you would get a sense of where this pilot will ultimately be housed? I know essentially that's PMI's and also OCS role of like the safety ambassadors, for instance. You get it up and going, and then you're going to hand it over to NSD. But wanted to get a sense of where this one likely would be housed, considering there is an existing program in MPD, City Attorney's Office. Would this also ultimately live in NSD?
Chair Chavez, Councilmember Wansley, we haven't gotten that far. That would be part of the early end scoping work that we hadn't quite gotten to. It's definitely a consideration as part of our discussion. We've already been talking with City Attorney's Office about how kind of awkward it is in some ways to have the juvenile diversion contract out of their office when they don't handle any juvenile cases. And so there's a larger discussion to be had about where this lives as well, but we just haven't gotten to that conversation yet.
Okay, thanks. And then just wanted to also get some more information in terms of like the uniform specifically for the safety ambassadors. I was really excited to see that piece because I think time and time again, something that we've heard with some of the other violence prevention or non-armed safety services that we have at the city is that identification piece of not knowing, especially since we contract out this work, is a particular vendor doing this on their own time in partnership with another, entity, or is this happening in response to like their partnership with the city? So just wanted to get a sense of, how you all landed with the uniforms.
I'll let you take that
one. Chair Chavez, Councilmember Wansley, so we have designed the uniform to have City of Minneapolis branding and are working in collaboration with the vendor to figure out how we can have the focus be that this is a city-provided service provided by the vendor as a contractor versus as the vendor's program. So in negotiations with the vendor on that, but ultimately wanting to have City of Minneapolis branding so that there's like a consistent look between all safety ambassador programs.
That is really exciting to see. I think coming out in 2020, we had a large debate with some of, as you mentioned, the vendors who do some of our non-armed safety services around just because of a lack of trust with the city, the impediments that comes with that of them being in the community and wearing a city's brand, quote unquote, but seeing how BCR has been able to do really great work while also maintaining that this is a city-sponsored program and there is branding, that identification. I think has shown we can do this, and also just being able to have more transparency around who's providing these services. As you just highlighted, this is not a vendor program. This is a City of Minneapolis program, and making that clear for constituents in case there is a concern, they know who to relay that to. So I was very much excited to see this. Is there other pieces of identification that will complement the uniforms as well to support that? This is a city initiative.
So right now we have the shirts designed, and then are thinking of having sort of like a vest in the wintertime to wear over like jackets and coats and that sort of thing. So those are the two items of uniform or identification that we have.
Okay, good to know, because I know with the DID program, they have their vests, own type of like I forget the color. When I've walked downtown, it really looks like a traffic control vest sometimes, and it's just like, okay. So this is really good to hear. See, a color scheme. Do we have a color code for the city? Who's been here the longest? Seniors, staff. Do we? What's our color scheme?
Chair Chavez, Councilmember Wansley, there are different blues that are approved as part of the logos and the color scheme for the city. One of the challenges that we had was when we're working with a vendor, they only offer certain types of blue. So we were trying to find a kind blue that fits within our color scheme, but also that is distinct enough so that they're not mistaken for the police officer uniform, for example.
Yeah.
So there was a lot that went into the discussion about color, whether there were badges or patches, whether we had jackets or vests, like you said. And part of what we're going to do is learn. That's the benefit of this being a pilot, is we'll see how those communities respond to the different pieces that we provide and if we need to adjust in the future.
Yeah, I was going to ask about the jackets piece, because we are in February. You all are about to get this up and going. We just had like a mini blizzard. Essentially, if there would be, again, I've seen that in downtowns with the DID program. They wear those vests over, some of the workers wear the snowsuits, especially when it's below negative and they have to walk the street. So just trying to get a sense of like, this makes sense when it's nice outside, but how to also maintain that identification when we're in like the Arctic jungle season that we're in now.
Yeah. And Chair Chavez, Councilmember Wansley, what we're thinking about purchasing is short-sleeved and long-sleeve polos, and then the vests that could go over jackets that they provide. We also looked at what DID provides for their staff, and it's hard to completely replicate that model because that is a very expensive program. And we can't do all of those parts. So we're trying to do the parts that we can within a reasonable expenditure, and then we'll see if that works for future.
No, thank you. I was, again, very excited to see this standardization of identification here. So hopefully that can go across to some of our other programs and NSD too with some of our contractors. So thank you all. This was a great presentation, and I look forward to seeing more updates about this work.
Thank you. Next up, we have Councilmember Rainville.
Thank you again. Thank you both for your presentation. Quick question: when you say that the Southside Safety Center will open in 26, it's on track. Is first quarter, second quarter?
Chair Chavez, Councilmember Rainville, that is $1 million question. I do not have an exact timeline yet. My guess is it would be later in 2026, but I don't have a month even that I've been given for a date.
Okay, thank you. And then the second is just a comment on the times of the embedded social worker that they're stopping at 8:30. My experience with this new non-armed public safety, specifically the violence interrupters that are working along the riverfront, 8:30, the problems don't really start until 10, 11, 12 at night. And I'm not second guessing you, but as you go through this, I'm just, my experience is that they would be needed later on in the evening, and that's just an observation. So as we go forward, that's something I'll be looking at.
Chair Chavez, Councilmember Rainville, we did look at the data about when the most calls come into 911, and part of the consideration, I think that we included in the presentation, was that because this is new to 911, we needed overlap with leadership in that program. And so we needed them to come in earlier so that they would have those touch points with leadership and yet work later when some of those calls start to come in. We were hoping that it would be a balance of that late afternoon, early evening time when they would be responding to more calls and then having the first part of their shift so that they could be doing the follow-up work. But this too is a pilot, and so we'll be measuring how effective it is and how many calls we're missing in the other times. Director Hodney has often told me that she would just like all of our pilots to be 24/7, and we can't quite make that work yet.
And Director Urgent, I am by no means second guessing you. It's just my observation with Mad Dads, 21 Days of Peace, Mother's Love, Somali's Youth Link, they work later, and that's because they're needed later. So that's the reason I raise that. But I look forward to your next report. Thank you.
I think last on cue, unless other folks get in, I have a few things. One, thank you so much for the work that you all are doing on the Community Safety Ambassador Program. I think it's really great. I think the component of the engagement that you all have done to get to this point is really exciting. I have heard from, families and, folks that work with our youth and our students at South High School about when they get off the light rail, maybe they need that safety escort. So I want to give you kudos for that engagement because I've heard that myself, which means that you have done that engagement and you heard that as well and you all have included that as part of this, program. So that's really exciting. So I just want to say thank you to you, PMI, and our staff for the work that you all are doing on this. The other components I want to talk about is on the Lake Street Safety Center component, the filing police reports. That's going to be really great. I think that is going to be a benefit to the people in the area, and that's hopefully going to drive more traffic to the safety center once in a month or so that you talked about the potential of making that happen. So thanks for working with staff and making sure that that is a new asset that's going to be available. I did have a question. I know that I think Narcan is going to be available at the Lake Street Safety Center. Can you explain how someone would access that?
Chair Chavez, Narcan, or naloxone, which is the generic version, is already available at the Lake Street Safety Center. It's just out on the bookshelf that's in the front entryway, and so I actually saw this in real time the other day. A community member can walk into that front entryway, grab a box, and leave. They don't have to provide any identifying information or explanation.
Cool. Perfect. And I want to be able to communicate that with residents because folks always like, how can we have more access to Narcan? And that's an area that definitely needs it. So thank you for that. And the other component I was going to ask about, and maybe I missed it, you talked about the traffic control, the pilot component, and you said that's going to be from 11:30 a.m. to 8 p.m., or can you correct me on the time again?
Chair Chavez, yes. We were looking at 11:30 a.m. to 8 p.m.
Okay, perfect.
Correct.
And then do we have a timeline for an estimated timeline of that, or still in development?
Still in development with
perfect.
timeline.
Cool, sweet, thank you. And that is all the questions that I have, and really thankful for this presentation that you all worked on. I think this is a really positive update for our city and important work that needs to happen, so just thank you very much. I think that was the last person on queue, so we appreciate the presentation. All right, so seeing no further questions, colleagues, I would direct the clerk to receive and file that report. And seeing no further business before us, I would declare this meeting adjourned.